Today, critical care physician Douglas Shaspy is on the other end of the stethoscope.
Great.
He's the patient and about to undergo hip replacement surgery.
There was quite a bit of arthritis in the hip.
Dr. Shaspy is just one of thousands of older Americans having this surgery every year, and orthopedic surgeon Dr. Charles Clark is leading the surgical team.
I'll be cutting the femoral neck roughly in this area here, taking out the ball.
About 280,000 procedures are performed yearly at an estimated cost of more than $12 billion.
Until now, there really hasn't been good data looking at what happens after the surgery, at the complications, at the readmission rates, at the length of stay.
Dr. Peter Cram from the University of Iowa and co-authors examined the surgical data of almost 2 million U.S. Medicare patients undergoing primary and revision hip replacement over the last 18 years, between 1991 and 2008.
Patients are much more complicated today than they were 18 years ago. Yet, mortality after both primary and revision hip replacement remains extremely low.
The study appears in this week's JAMA, Journal of the American Medical Association. Researchers say hospital stays for these patients, in most cases, have been reduced by half.
So they're in the hospital for a shorter period of time, but they used to go home. Now more patients are requiring rehabilitation or going to a care facility rather than returning right home after their surgery.
Rates for patients being readmitted to the hospital within 30 days of surgery are also increasing.
There's really no free lunch here, so as length of stay has gotten shorter, less patients are going back home after their hospital stay, and more of them are requiring to go to some sort of rehab.
With his surgery almost completed, Dr. Shaspy is scheduled to return home, undergoing rehabilitation there, minus the pain in his hip.
I've always been pretty active, and I'm looking forward to remaining active and healthy.
Catherine Dolf, the JAMA Report.